In this short video, I'm going to give you an incredibly easy tip, short times, many times, to help accelerate your recovery. Hello and welcome back. I'm Rosen and thanks again for watching. If you haven't already, please subscribe so you get updates when these new videos come out. And if you could take a moment right now and just click that little thumbs up button below, it helps people like you find content like this. In today's video, I'm going to talk to you about short times, many times. It's something that I've talked to patients about for many, many years. But I really started thinking about this because what you might not know is I've been a pretty long-term meditator for over the past decade. I was taking a course recently by Mingyur Rinpoche, who's one of the most prominent meditation teachers of sort of our generation. And he talks about this idea of short times, many times. Instead of meditating for a half hour, you might find that meditating for 5 minutes or multiple times throughout the day can be helpful. And it's the same theory or philosophy that I've taught my patients when it comes to rehab after knee replacement. So if you have knee arthritis, you've probably experienced this without thinking about it. If you sit through a long dinner or a movie or a long car ride, when you go to get up, you find that you are really, really stiff. The knee takes 10 or 15 steps before it even starts to loosen up a little bit. So what many patients start to learn or realize is that if they get up frequently, they tend to have less stiffness. And everybody has sort of a time limit as to when sitting for too long is too long. But the same can hold true after knee replacement surgery. If you're sitting on the sofa and you're elevating and you're icing, when you go to get up, you run into the same difficulties. And when you try to do physical therapy, you also run into the same difficulties with trying to get range of motion, both bending or flexion and straightening or extension. So what I'm going to give to you today is 3 simple tips to work on both motion and work on your bending and straightening exercises after knee replacement surgery. You may have heard the term motion is lotion, and that really holds true for joints. We have to move the joint to lubricate the joint and make the tissues more supple. After surgery, if you sit for too long, you will tend to get stiff. The knee will get stiff, the muscles get stiff, the soft tissue gets stiff, and that makes it really hard to get up and get moving. So what I recommend to my patients after surgery is every 30 to 60 minutes, you should get up. You might take 1 or 2 long walks every day during your recovery, and that distance will increase over time. But even in the beginning, the first couple days, every 30 to 60 minutes, set an alarm or a timer and get up and move, even if it's simply walking around the room. This helps in many ways. The more that you're up and moving, the more that you're up and walking, the lower your risk of getting a blood clot. The other thing is that the more you're up and moving, you're going to lubricate the joint. You're going to help mobilize the tissue. That can also help decrease swelling, because when we move our feet up and down as we're walking, it squeezes the muscles, which helps circulate the blood in the calf and the knee, and that can really help improve your range of motion because the knee and the tissue therefore is not swollen. Bending or flexion can be hard for some patients to get after surgery. Average range of motion in the world is between 115 to 120 degrees of flexion, and some people really get stuck around 90. So if you haven't already, check out my video, Best Range of Motion, because I cover this really simple chair exercise that's going to help you improve your bending after surgery. But when I show this to my patients, I once again recommend this not once a day, but short times, many times. So you might do your therapy 2 or 3 times a day, which you should in the first couple weeks after surgery. But this one chair exercise or any bending exercise that you find to be helpful should be done every hour on the hour while you're awake. And what I recommend to my patients is sitting in the chair, do these heel slides with this added push to help get that better flexion of the knee every hour on the hour. So you set your alarm, you sit in the chair, you do this 1 or 2 minute exercise, and then you can do the rest of your exercises later, or you can sit and you can elevate it, read a book, watch a movie. But then the next hour comes up and you once again do this bending exercise. Otherwise, if you sit for hours and then go to do your therapy, the first half of that therapy is just trying to get the motion to where it was yesterday or your last therapy session. That might take half of this therapy session, so you have very little chance of making additional gains. If you keep the tissue around your knee stretched out every hour on the hour, when you then do your next physical therapy session, you're basically starting where you left off. and you have a better potential to get more range of motion each therapy session going forward. The other important tip is working on extension, or what we call straightening. So if you have arthritis, pretty good chance that you have not been able to straighten your knee for many years. You have what we call a flexion contracture. And if you're like many people, you also probably have tight hamstrings. And if you've had surgery, many people deal with swelling, which can really limit the ability to fully straighten the knee. So these three things together can make it really hard to get extension. And if you don't get it, there's a good chance you might never get it. So again, like the bending exercise, if you do your therapy just a couple times a day, the first half of each therapy session is going to be working on trying to get back to where you were at the last therapy session. And then you might have a short amount of time where you make additional gains. But then over the next 6 or 8 hours, it can tighten back up again. So still do your therapy 2 or 3 times a day, especially in the first couple weeks. But this straightening exercise, and again, you can watch my video Getting Straight, is a simple chair exercise. It's basically putting your heel up on a chair in front of you, putting your hands above your knee, firing your quad and pushing the knee down and holding it for 30 seconds. But I have my patients do this every hour on the hour while they're awake. So if you do a 1 to 2 minute straightening exercise every hour on the hour while you're awake, when you do your next therapy session, the hamstrings are looser, the knee is closer to being straight, and you have the potential to get more range of motion in that physical therapy session, as opposed to just trying to catch up to where you were ending your last therapy session. So there you have it, a short video that you don't have to watch many times, but hopefully this helps aid in your recovery. Three important things to keep in mind is get up and move every 30 to 60 minutes. This helps improve your range of motion, can decrease swelling, and can decrease the risk of you getting a blood clot. And then every hour on the hour while you're awake, do a 1 to 2 minute bending exercise, a 1 to 2 minute straightening exercise. And what you're going to find is that when you then sit down to do your formal physical therapy, your knee is looser, you don't spend as much time warming it up, and what you're going to see is better gains day to day throughout your recovery. Thanks again for watching. I'm Adam Rosen. Until next time, stay safe.